Local leaders and first responders aren't alone in this fight against COVID-19. In fact, they need all of us to pitch in and do our part to stop the spread. We were reminded of this today by Dr. Bob-Lutz with Regional Health, who also said the paths you should take if you think you're coming down with something. 4 News Now reporter Taylor Graham is working remotely tonight. She's breaking it all down.
Maybe with the exception of very young children, every age group is affected. Certainly older individuals appear to be more susceptible, but that doesn't mean 20 to 30-year-olds are not going to get infected.
COVID-19 has claimed the lives of hundreds, but countless others may not even know they have it. So here's a good rule of thumb to live by. Act as though you've been diagnosed with COVID-19, no matter how you're feeling.
We have a vast majority of people who have very mild symptoms, if symptoms at all. They are, however, contagious. And that for me is very concerning because that would suggest that I have people in the community who are contagious. Maybe they're not social distancing appropriately and therefore infecting others.
You might have symptoms, but screen yourself first. Ask yourself if you're high risk and if you have a fever and respiratory problems. If you keep answering yes, call your doctor or a local nurse hotline. They'll screen you over the phone and refer you for a test. Dr. Lutz says you don't need a physical referral to get screened at the fairgrounds testing site. Now, if you are showing symptoms but you're not high risk, Dr. Lutz says you might have COVID-like illness. He says it's best treated by getting a lot of rest, drinking a lot of fluids, and staying home until at least 3 days after your fever is gone or 10 days after your symptoms started showing, whichever is longer. All good rules of thumb to live by, no matter how you're feeling right now.
You may not be symptomatic, but you could significantly impact older people that you come in contact with, such as your parents and such as your grandparents. But think of them just as importantly as you think of yourself as you go about your daily lives.